Toxic shock syndrome is caused by two types of bacteria, Staphylococcus aureus and Streptococcus pyogenes. Tampons can cause toxic shock, and if not treated can be fatal. Seizures, bleeding, and heart failure may occur, and organs, such as the liver and kidneys, may begin to fail. What really is a toxic shock syndrome? It's caused by toxins produced by these bacteria. It's a rare and life-threatening condition as a result of a bacteria infection. Besides tampons, you can also get it from bacteria infections that resulted from after a vaginal birth or caesarean section, from a cut, wound, boil, or burn, from a contraceptive diaphragm or cap. Pneumonia. The palm, sole of the feet, tongue turns red. Symptoms suddenly starts with a high fever, a rapid drop in blood pressure, with lightheadedness, diarrhea, headache, sunburn like rash on any part of the body, including the palms of the hands and the soles of the feet, muscle aches. Other signs are vomiting, confusion, weakness, tiredness, peeing less than usual, bloodshot eyes. Treatment is with antibiotics to treat the infection, fluids to rehydrate you, medicine to help control your blood pressure, oxygen, surgery to remove infection from cuts or wounds. For prevention, washing your hands well before and after inserting a tampon. Alternate tampons with sanitary napkins. On low-flow days, use pads instead of tampons. And if using tampons, choose ones with the lowest absorbency that will handle menstrual flow. And change the tampons often. Between menstrual periods, store tampons away from heat and moisture. Store in the bedroom rather than in a bathroom closet. Do not use tampons if you have had toxic shock syndrome before. Do you know toxic shock syndrome dropped drastically because research led to better tampons and better habits for using them, such as changing them often? Thanks for watching, and don't forget to subscribe and press the notification bell.